So joining me now is consultant obstetrician and gynaecologist at Epsom and St Helier University Hospital NHS Trust, Antoinette Johnson. Antoinette, thank you for talking to me.
Oh, thank you, Eddie.
In terms of what you heard, I don't know if you know Funke personally, but certainly it's a story I'm guessing you're familiar with. What's your takeaway from hearing that piece of audio?
Oh, it is a really sad story to hear. Losing a baby at whatever gestational age or whatever the circumstances is completely devastating and such a life-changing event. And it's something that would stay with you forever. The good news is that here at Epsom St Helier, we do provide a range of support to moms and families who have experienced a loss in terms of during the days and the weeks and months ahead, trying to understand the circumstances around it and what could be done differently next time.
Well, I guess we brought you on because you deal with the physical. I can't help but talk a little bit about the mental. And certainly as a team, we've been talking about it. Why do women not talk about being pregnant quite often until the third month? It's because sometimes it doesn't go past that. And there's a certain shame attached to it. Is that right? I mean, I know there shouldn't be. Please forgive me if I misspoke. I'm not saying there should be, but I'm just trying to understand it. Do you think there's an element of embarrassment, of shame?
I think, it's a difficult one because after a baby loss, it's so devastating. And sometimes moms and families are still trying to process what has happened. Baby loss, as you know, can happen at different stages. For some patients, they may have had an early pregnancy loss. And they're still trying to process and therefore not ready to talk about it because they're finding it quite painful. We know that mid-trimester losses as well. They've been preparing for the delivery. Sometimes shopping has gone on and their baby clothes and things around, particularly with the late losses like Funke. And so they're still trying to process it, and therefore it's really hard, even in years to come, because the effects are quite long-lasting. We here at Epsom St Helier do provide counselling support for mums. We can also provide support in terms of continuity of care through our bereavement midwife team. She can actually caseload some of these patients so they seeing the same midwife and not having to go over the story over and over again, because that's like just taking a scab off an old wound. So there is a lot of support that is available for women, and we don't stigmatize patients as well. Our staff are quite skilled and compassionate in providing the care.
Yeah, I mean, for me, this isn't, we've asked you because you work at a London hospital, and it's not judging any of the people that work at hospitals. Today's really about, how we can help inform the people that might be going through this. And, one of the things I've noticed looking up on it, it isn't perhaps as uncommon as some people might think.
That is correct. We know that miscarriages are probably about 1 in 4 pregnancies can end in a miscarriage. Unfortunately, up until recently, miscarriages weren't actually being counted, so we don't exactly know how many miscarriages do occur in the UK, but there is an estimate that it's between 110 to 150,000 miscarriages happening each year. It is a big number, and if you think about it, it's not just miscarriages that are baby losses. We have patients who have an ectopic pregnancy or a molar pregnancy where what should have been a placenta has become an abnormal mass of cells. And there are patients who have premature deliveries like Funke experienced, and an early neonatal death, or patients who their baby dies after they've gone home, so sudden infant death as well. And these are all baby losses that need to be remembered, especially at this sensitive time.
Indeed. In terms of then, I suppose it's a learned thing, isn't it? Because each and every person would have a different reaction. Some people might seem okay, and then as time goes by, one of the things I remember Funky saying, as you pointed out, is that people keep asking, "How is baby?" And then you have to relive it. Can you just articulate for us some of what you do in your position?
Yes. So, in my position, I do see patients for infertility, and some of these patients may have had a baby loss before and are still trying to fall pregnant, so they still don't have a baby at home. Some have experienced recurrent miscarriages, so recurrent baby losses. Others may have even had a termination of pregnancy and are feeling quite guilty about it. So it's having to navigate those different emotions that may come up during your consultation, and making patients feel at ease and open and have conversations with them for the future as to how they could fall pregnant. I also are a specialist in maternal medicine, and unfortunately, with some of the medical problems that women experience in pregnancy, there is an associated increased risk for baby losses. These may be conditions such as high blood pressure, diabetes, systemic lupus, patients who may have abnormalities such as in the immune system, such as antiphospholipid or sticky blood condition. And in these sort of scenarios, it's important that we explain to patients even what we call preconception counseling, which we do for women who have medical problems, to explain to them what the risks are and how we can support them during the pregnancy in terms of treatment, extra monitoring, planning for delivery, and linking them with the right teams who can monitor them throughout the pregnancy and support them throughout, like our counseling and bereavement teams, which we are quite proud of.
And, you know, it doesn't escape me that in that piece of audio that we played, that was as much about dad as it was about mum. Do we sometimes forget the people that care for the people who are going through the trauma? I mean, because you could argue it's both of their stories, even though it's something that mum is experiencing firsthand.
You're absolutely right. I think in the past, maybe going back more than 10 years ago, it probably wasn't, dads weren't included in the picture, but I must say that now the care is for both moms and dads. So it is for the family. As I said earlier, our counseling midwife would actually do counseling for both mom and dad, and this is available during pregnancy and after pregnancy. Counseling support is also available for patients who may have experienced the loss in the past or have been given some bad news during the pregnancy. For instance, they may be at high risk for a preterm birth or a baby that has a congenital abnormality, which may have, difficulties or challenges after the delivery. Counseling support is available for such families as well. Similarly, our bereavement midwife would rarely take care of families. She provides that one-to-one care, very practical care, and following the pregnancies through. And these may be patients who may have experienced a baby loss in the past, or patients who have just had a loss, and she would follow them throughout the coming weeks and months ahead.
Just a point on that. I mean, years ago, I came to this subject because lots of women who found out when they'd had the injection that there was a possibility that their child might have Down syndrome, more people were choosing to terminate. And that's not my question. My question is more about how much does age play a part in how concerned, interesting, carefully you monitor people?
So it is a good question, Eddie. We would provide personalized care. So like I said before, our staff are very skilled and provide compassionate care throughout a woman's pregnancy. We would do risk assessments at every stage throughout pregnancy, and particularly on the initial booking appointment. So the first visit is what we call the booking appointment with the midwife. But sometimes we have patients who actually have medical problems in pregnancy, like I said earlier, and we sometimes would see these patients in our obstetric clinic, so the doctor's clinic, even before a midwife sees them for booking. And we risk assess and then determine the kind of care that they require, which will be discussed with the woman, and we agree a pathway for the rest of the pregnancy. Age is a risk factor, unfortunately, but there's so many other things, like I've mentioned, like their medical problems. Some patients may have had some treatment to their cervix for abnormal smears. This can put them at increased risk for a miscarriage, maybe in mid-trimester or premature birth. And so these are all aspects that we take into consideration when we risk assess and decide on a care pathway.
Thank you so much for talking to us today. Is there anything that I've missed? Is there anything that you came on here thinking I really hope comes out? Because I am minded that we are trying to help people here. So if I've missed anything, is there anything to your mind that might be useful?
Yes, I think that, there are a few things, I'd just like to say. One is the aspects that, our dedicated staff do provide a full range of support for women and their families who have experienced a baby loss or have received some bad news which may threaten a baby loss. And there's also the important aspect of recognizing that our maternity services were scored the best in London by moms in our recent CQC survey, and staff were praised for their kindness and compassion. We would like to say, to all women out there who may have experienced a baby loss, that we are standing with you. We are always working to improve our services. We listen to moms and aim to make a difference in how we provide our care. And we know that there is always hope. Having had a baby loss, just like with Funke's story, doesn't mean that you would not have a family of your own. There is hope.
Thank you so much. Appreciate it. Consultant, obstetrician and gynaecologist at Epsom and St Helier, and I'm pretty sure that anybody at any hospital in London would hope that they get the same treatment as you just heard discussed there. And that's Antoinette Johnson. This is BBC Radio London.